lost the numbers now. Yep, 1-1 of 213, 1-1 of 11. Sometime. I always wait till a minute or two after. Just, so you got people coming back from lunch. Not that they should be on lunch that late, but you never know. This is this, okay, and if anybody has any questions that we can't answer, it's better than bullshit, it's better to just tell them, we'll get back to them. Yeah, I'm gonna write them down. Fortunately, which is nice, because we kind of led, I think it was the one, I don't know, like it was Anne Marie maybe, put it in email form sometimes too, because
That's helpful.
it's helpful.
Especially
Exactly what, because sometimes when you're verbalizing, I'm understanding, but man, sometimes I'm so overwhelmed, I can't absorb it all, even from writing it down. Put it in email, everything you want. You know?
One for Wednesday.
Oh, good, thank you. You better hold on to that, I'm on motorcycle. I can't even fit anything else in there. Couldn't even fit my squish water bottle in here. I need to throw it out. It was cold coming into work this morning. Very cold.
It's feeling strange and
Isn't
like,
it?
oh.
Yeah, I know, I hate that too. Yeah, I had my heavy leather jacket on, my chaps on, and they're all, oh, I bet you were, yeah. Isn't it though? I hate it that way, I mean, I like it hot, or at least comfortable, not freezing. No, we don't, do we? You about ready?
Yeah, there's a lot more people on now.
Oh, okay.
But yeah, whenever you're ready.
Okay, I think we're gonna go ahead and get started. Good afternoon, everyone. Okay, this is Tracy Gray with the CHIP program, and I also have Dave Hoptack here with me, and we are going to talk through the new prospective payment system that is replacing the previous process of payments to FQHCs and RHCs that provide care to the Children's Health Insurance Program members. The functions that are available for health center users, you will have access to specific screens, and as a health center you will have access to the contact screen as well as several reports. When you're using the system, if the system requires more information, you will be prompted by a window letting you know that certain information is required. For example, here we have the MCO name or effective date. If you do not put that in, you will get a box letting you know that. The format of the messages has to be in a specific format. Again, if you put in a date with an incorrect format, you will receive a button that says enter valid date. Other screens and buttons in the timeout period. Two important buttons that you will have in the system are the save button. This is used to add data into the system. If you do not use that save button, your information will not be saved. If you are working on one screen, going between several different FQHC, RHC sites, and you want to look up another site, you want to clear the fields and start again. After 20 minutes of inactivity, your session will be timed out. Are there any questions at this point? Okay, the PPS system login. Each FQHC RHC will have a unique sign-in for testing as well as production. Testing has been completed prior to this, and we're not sure if there will be further testing. If there is, we will let certain centers know. For user sign-on information, each center will have a unique sign-on again, and will also have a password. This is what your sign-in screen will look like. This is where you will enter the system. This is a web-based system, so the second bullet there is very important that you have that website. That is where you will access the system. And here you will see the log-on screen where you will enter your username and password. If you forget your username or password, there is a window there, self-service for business partners. You can use that to have your user ID or password reset. If for some reason that doesn't work for you, you can also send the CHIP office an email at the through the PPS mailbox, and we will help you get that reset. And this is what the home screen looks like for the PPS system. This is where you will see several different options across the top of that. There's the home button, the MCO data management. That is where MCOs will enter encounter data from all of the FQHCs and RHCs. There's an FQHC RHC data management. That's where you will go in and update your contacts. There's an encounter and payment data management. There's a payment calculation tracking, and there's a reports button. The reports option is something that you will also be using as a health center. So two of the areas that you will have access to are the contacts area and the reports area. Again, the contact area is where you will keep contacts from your office, and that will allow us to contact you regarding issues that come up. The reports that you will have access to are the contact report, the disputed data report, and a summary report. The disputed data report is a report showing that you have disputed some of the information that the MCO entered in terms of encounters that you have reported to them. Are there any questions? Okay. You want to log on to the system for the contact report, select the FQHC RHC data management, and then click contacts. And the health center contact screen will appear. This is what your contact screen will look like. And if you'll notice on the right-hand corner, there is an edit button. This is where you will edit the contact information for your health center. One note is that to keep in mind is that you cannot edit the name fields. You can edit the job title, email, phone number, fax number, address, but you cannot edit the name fields. That must be done by the CHIP office. and that would require an email to the PPS mailbox. To edit the information, you would put your cursor in the field, delete the existing data and type in the new data. And again, you must click the Save button to save your changes. To view or edit information for another contact, you want to use the Clear button, and you will start over again. The name of your Fqhc RHC appears in that field. Your existing contacts appear in the contacts grid below. So again, just to recap, you can make changes to existing contact email, address, and phone, but you cannot change existing contact names. You cannot add new contacts. You must contact the CHIP office to have contacts added. This is for security reasons, and you must let us know right away if someone needs to be deleted so that the access can be changed. Because this is a web-based system, you can pretty much log onto it on any computer. So it's really important that we keep that updated. If there's someone who leaves your company, you need to let us know that. If they no longer need access, we need to have that security and have them removed. Disputes, this, from what I understand in the past, was a very long, lengthy process. We will be putting time frames on this. When you go in to look at your reports on a quarterly basis, you will need to let the MCO and the CHIP office know if you are disputing any of the records in the reports. The only way that we can return that report to the MCO to be changed is for the health centers to let the CHIP office know. We will mark the database and the report will be returned to the MCO. At that time, there is also a time period for which the health centers and the MCOs need to work out the disputes. This has taken some time in the past, so we are putting some guidelines out and that must be followed in order for the disputes to be resolved. And we will be providing those dates in the near future. So some of the reports that you can get to from the main menu. You want to click on the reports option, and you will select the name of the report you wish to run. That will be populated. After you have made your report selection, you will click the report or the view report button. And you will select the Fqhc RHC contacts report, and you will select the name of your health center, and then when you click the view report, the report appears. This will show you, in this example, there are 3 contacts in here for Aetna. Another one of the reports that you will have access to is the disputed data report. Again, you would select that report from the report drop-down list. You would select the reporting period. Since this is a quarterly report, you would choose that quarter that you're interested in looking at. You would select the name of the health center and then click the view button. You notice on this report screen, you will see disputed data reports from the prior fiscal year on the top, and then you will also see disputed data report for the current fiscal year. So this is how we will keep track in the system of the disputed data reports. And the last report that you will have access to is the summary report. Again, you would choose that particular report from the drop-down menu, choose the reporting period, choose your health center, and view the report. And this is a screenshot of a summary report. In the left-hand corner, you will see the name of the Fqhc RHC. You will see the MCO, dates of service, and the MCO listed below with all the service locations that serve that MCO. You'll see the number of medical encounters. You'll see dental encounters, and you will see vaccine costs. This is the information that you need to review to make sure that what you have reported to the MCOs has been put in the system correctly. The CHIP office will be mailing out to your contact list to let you know that it's now time that the quarterly report has been entered and that it's now time for you as a health center to review all of your encounters data. We will give you a 30-day time period for that. And we will also be providing these dates of when the summary reports are available. So again, it's very important that we have updated contact lists, because this is a reminder to you that the report review period has started and when it is due. So as soon as there is any change in your contacts, we need to know that right away so that we make sure that we're communicating with you on a regular basis. There is a system glitch that we wanted to bring to your attention, and our IT is working on that to get that fixed. But one of the things that you will notice on here is that the page numbering will always read 1 of 2. That does not mean that the report is only 2 pages long. The user and the system user must page through and click the arrow until they see the end of the report. This particular report could be 15 pages long, but it will still appear that it's only 1 of 2 pages. So you want to make sure that the folks who are using the system are aware of that. Just remember to click through all the pages. Are there any questions at this point? Okay. Logging out is very simple. It is in the upper right-hand corner. There is a log out button, and you want to make sure that you do that each time you are leaving the system. Testing, we've already been through the testing phase, and again, like I mentioned in the beginning, there may be some additional testing. If that is the case, we will reach out to the FQHCs and RHCs who were a part of that testing process. If you encounter any problems during your use of the PPS system, you need to email the PPS mailbox, or you can also contact Dave at the number that's listed there, and he will assist you in any way that he can. Okay, all right, well, we would like to thank all of you. I just want to make sure that if you haven't sent in your contact information to the PPS mailbox, we still have some contacts that we're looking for, so please make sure you do that, and you should be hearing from us in the near future about the new system. Thank you.
Billing, Regina speaking. How may I help you? Hello?
We're sorry, Regina. We've got to hang up after the conference is done.
Okay. All right.
Are we done?